तो हम लोग बैलेंस डाइट पढ़ रहे थे। तो आज हम बात करेंगे डिफरेंट एज ग्रुप में किस तरह डाइट बैलेंस बनाने की प्रोसीजर। सो वी आर टॉकिंग अबाउट बैलेंस डाइट। So how to make balanced diet plan for different age groups. So today we will discuss that. Okay. First is children. We will talk about children. How to make different diet plan for children. Then adult, then elder people. Okay. First, children who are 2 to 12 years old. Okay. So first is balanced diet. In the balanced diet, we will take three things here. Three things. Number one, fruits, vegetables, whole grains, and lean or proteins. This is the first thing we will take. And second is snack. And third is hydration. We have to remember these three things from the age of 2 to 12 years. Okay. First is balanced diet. In the balanced diet, we have to take fruits, different types of varieties of fruits, vegetables, whole grains, and we have proteins, protein rich food. Okay, protein rich food. Snacks, second is snacks. In the snacks you can take, we have vitamins. Vitamins like we have fruit. Fruits also having, in the type of snacks you can give whole grains, cheese, butter. Okay, whole grain bread, apple slices, etc., etc. In the third, hydration. Okay, hydration. Hydration, in that first you have to advise the water. Water is the main source of hydration. Or sometimes you can advise fruit juices. Okay, fruit juices, fruit juices. So these are the three things you need to add for children. So how you can add? You can have one chart like time of the day, next meal, next food item. So you to make this first. Okay, first is breakfast. So okay, first breakfast. So you can prepare 2 days, 3 days, 5 days breakfast, different types. So first we will make for one day only, 1 day or 2 days. Okay, 1 day or 2 days. So for one day, we'll make whole grain. Okay, whole grain, whole grain with milk. Okay, and some fruits. Okay, some fruits. It is the first day breakfast. We'll make 2 days breakfast. Second day, You can have uh, in the place of grains, you can take any type of fruits, only fruits here. Okay. So this is the second day breakfast. You can advise the person. In the whole grains, you have different items like cereal, okay, and uh, you have cereals in different types of cereals you can take. Fruits, you have different types of fruits you can take. First, one day apple, orange, banana. Likewise, you can advise the patient. This is the first day, and mid morning snacks. Snacks, you can prepare the snacks for the children. Snacks or mid morning snacks. Especially one day you can advise apple slices. If you give orange on that day, second day you can give snacks, apple or bread plus anything, cheese or egg omelette. This is a good idea. Okay. In the lunch, you can make vegetables, different types of vegetables like carrot. Okay, and different types of vegetables are there. Some one day carrot, beetroot, or one day we have peanuts. Everything is there. You can uh, drumsticks, different type, broccoli. Okay, you can give. And sometimes you have the high protein diet like chicken. Okay, if it is okay, vegetables, chicken. Okay, all this you can take in the afternoon lunch for lunch. So different types of vegetables are there. You can one day one vegetables you can prefer. Next is afternoon snack also. Sometimes you can go through with snacks, or else if you are taking dinner early, you doesn't need snacks. Or else you can go to the snacks. Snacks, you have fruits, one option, or second option is that any nuts like almonds or dry fruits. You will go with dry fruits like you have anjeer, dry kaju, etc., etc. One day, one uh, dry fruit you can try for the snacks. And dinner. In the dinner, you have different things like uh, rice. Okay, you can advise rice to the uh, children, or salad, milk, brown rice, or sometimes you can go through with protein rich food, mutton, chicken, fish, eggs. Likewise, you can advise the children. So this is the basic thing, but you have to remember three things. One is, I advise that fruits in that first meal is balanced: fruits, vegetable, whole grains, and protein. Snacks, and you have hydrated water. You need to take advise the children to take water level, very important. Now adolescence, not adult, no, adolescence. Adolescence is the age group of 13 to 18. 13 to 8. 13 to 18, we have to focus here three things. One is rich food, nutritional, rich food, okay, and meal timing, and third is healthy choice. The next is meal timing is very important and healthy choices. Healthy choices. So nutritional rich food, meal timing, and healthy choice are the basic importance for you have uh, balanced diet. What is the nutritional? What are the things? Like we have to focus on calcium rich diet because in that age, I already tell you that this is a fire age. Okay, in that your body need to grow vertically as well as horizontally. So you need iron, protein. So you for growth development you need calcium. For blood health you need iron. For muscle development you need protein. Okay, so you need dairy or fortified plant-based for calcium, and you have to take meat, beans, cereals for iron and protein. So, and variety of protein sources need to take like fish, chicken, mutton, eggs, etc., etc. So, in this age, you have to focus on calcium, iron, and protein for bone development, for strong bone, for healthier blood, and for healthier growth, muscle growth. Okay. Next is meal timing. Meal timing is important. So, regular timing is important for gut health. If you take breakfast between 7 to 9, it is very good. 12 to 1, lunch, and 7 to 9, evening. This is the breakfast time, lunch time, dinner time. Between we have snack times, okay, which maintain the stability of carbohydrates in the body. Okay, so from the age of 13 to 18, to avoid of skipping meal, skipping breakfast, skipping dinner, okay, skipping lunch because it will affect their growth. Okay, nowadays it is very problematic condition. Most of the school going people, children avoiding the breakfast, sometimes breakfast, sometimes to study late night they are avoiding dinner. So it is very bad for to their health, which leads to many conditions, clinical conditions. Like next third is healthy choice. Healthy choices means education. Education, we have to explain about the balanced diet to the children. Okay, we need to give education about that, and you need to practice of implementation of this meal, snack. What is the importance of this nutritional food to the children to maintain the health sustainability? Okay, so this is the important thing. Okay, so this is about adolescence. Uh, so you need to program like that their diet. Okay, so first I will advise you that you have to make a list of all the food what we studied, like carbohydrate diet. Okay, first thing. Second is food, fat diet, in which the fat content is high. Third is protein rich diet, and fourth is vitamins. Fifth one is minerals. So you have to make all this different food, carbohydrate rich diet, 10 to 15 names, fat rich diet 10 to 15 names, protein rich diet 10 to 15 names, not 10 to 15, there are 5 to 10 in between protein rich diet, vitamin rich diet, mineral rich diet. So when you make this, so you can mm, put that diet into the lunch time, dinner time, breakfast time. Okay. Some things need like vitamins and mineral like food like nuts and fruits. You can make into the mini snacks timing. Okay. So according to that, every type of food you will get day by day, your body is in balanced condition. So this is the simple thing to make balanced diet. So what type of food you have to focus in a particular age? It is very important. Okay. Now in in adolescence, you have to after adolescence, after 18 to 65 years age, what type of food you have to focus? Need to once nutritional dense food. First is means low calorie needs but high nutrition value. Low calorie needs but high nutritional value like lean proteins, whole grains, fruits, vegetables, and you have to focus on mostly antioxidant food in this age. Okay. Next, to focus on calcium and vitamin D3 type of food, vitamin D, fiber rich food, because as age grows, your mortality decreases. So you need fiber rich diet. Okay. So you have to focus after 18 to 65 years or above age. You have to focus on these three things. Okay. According to that, you have to make the breakfast and other thing plan. Okay. So this is about the diet plan for adolescents and everyone. Next is for pregnant women. For pregnant women, you need to give all the types of food. She need protein, she need fat, she need iron, she need retinol, thiamine, riboflavin, mostly B complex. All according to all food, along with you need to focus on B complex for the pregnant woman mostly. Okay. For pregnant women, one example is that you can make one simple diet plan. It is for early morning, along with biscuits with tea, tea with biscuits, no nominal tea, not a high milk tea. I think I prefer for decoction. Breakfast, and you have dal, paratha, curd, dal plus paratha plus curd. Morning, early morning, breakfast. Mid morning, lemon water with poha, and you have lunch, salad, chapati, three chapatis minimum, paratha two here, three chapatis, rice, green grams, and vegetables, and raita. Okay, this is the one thing. Evening banana shake, almonds. Next evening after dinner, you can go with salad, chapati, and any nuts with green leafy vegetables. Bedtime, you can go with fruit, mixed fruit, mixed fruit. Okay, you can go with mixed fruit. So this is the pregnant woman. So means you have from morning to evening, you have to make a plan which have rich nutritional value and mostly focus on B complex nutrition, because for the production of blood you need more B complex food because it is water soluble. So you need daily basis. This is important. And because of sometimes some women uh, will have that what have they have anemia. So for anemia, you will go through with anemic uh, diet. So I will explain anemic diet something. So anemic diet, you need iron-rich food. Okay, first you have to check the hemoglobin levels. Okay, along with that, you need to take this food, iron-rich food, if the patient is anemia. Second is vitamin B12 source. Third is vitamin C rich food. Okay, all these are needed. Okay, so you have like example red meat for iron, poultry, fish, cereals, beans, spinach. Okay, eggs. All you need to take. Vitamin C, like oranges, strawberries, tomatoes. All these are rich in vitamin C. So you need to focus on this to improve the iron deficiency anemia or anemia in the body. Okay, so you need to give education, counseling, and the need to focus on the diet to the pregnant woman or anemic patient. So, so these are the important things you need to remember to maintain the pregnancy and maintain balanced diet. Okay, so these are the very important things you need to remember. Whatever things we discovered, we studied in this balanced diet. So anything regarding that you can ask.